Hello and welcome to this presentation discussing the RigiScan 4 generation device for nocturnal penile tumescence, otherwise known as NPT. Within this presentation, what we will assess is the overview of NPT and the actual product itself, with further clarity on its application. The background. Erectile dysfunction is a male sexual problem that impacts 25% of men worldwide. ED is categorized by the inability to achieve and maintain a stable erection and achieve satisfactory sexual performance, which may result in inadequate erection quality or ejaculation disorders. The process of achieving an erection is a complex phenomenon that is due to a delicate and coordinated balance between neural, vascular, and tissue components. ED can have a significant impact on both physical and mental health, as well as a significant impact on quality of life, affecting individuals and their partners. One important aspect of managing ED is identifying the underlying cause of the disorder in men, which may involve the use of NPT, such as with the RigiScan device to assess erectile capacity. The RigiScan Plus is a diagnostic device designed to assess erectile function by measuring two key parameters, penile rigidity and tumescence, otherwise known as penile circumference, simultaneously. These measurements help differentiate between organic and psychogenic erectile dysfunction by providing objective data on nocturnal and provoked erections. In general, NPT occurs during rapid eye movement or dream sleep in healthy males. To measure NPT, the RigiScan monitoring device has been suggested due to its convenient, cost-effective, and home-based monitoring capabilities. By this test, clinicians can differentiate between psychological and organic causes of ED. However, due to the diversity of sexual dysfunctions and their varying prevalence in different populations, there is a need for validation of NPT assessment devices in specific populations. So let's look at the RigiScan device in more detail. RigiScan is now manufactured by GOTOP Medical in the USA and has become the most reliable test for NPT. They have now released the 4th generation system, which has improved firmware and hardware, having increased communication speed between the PC and the device by a factor of 7. It utilizes alkaline or rechargeable batteries and has a changed tumescence measurement process due to reduced data noise in the chart, allowing you to get more valuable data. The design has improved to prevent corruption or loss of data and added more tests to reduce risk of cables getting entangled inside the instrument whilst in use. So what is in the kit itself? Within the protective plastic box, we have the RigiScan device itself, which comes with the adjustable loops and the loop covers. You have the USB stick for integrating the software onto your PC. It can run on an Apple computer as well, so long as that runs off Windows. We have the extra batteries in there. The cables for downloading can connect directly to a USB appropriate system. Then we have the leg strap cover in there as well, so the device measures and records penile rigidity and tumescence. So what it measures, penile rigidity indicates the hardness of the erection, expressed as a percentage, with 100% representing the rigidity of a steel rod, measured by applying a linear force of 10 ounces, 283.5 grams, around the penis, recording the cross-sectional response to radial compression. It also measures penile tumescence. This refers to the increase in penile circumference during an erection, monitored by 2 loops placed at the base and tip of the penis, measuring the circumference every 15 seconds. How it measures. The device components comprise of 2 non-elastic loops that are placed around the base and tip of the penis. Each loop contains a cable that moves freely inside a conduit, tightening slightly at discrete time intervals. The measurement process involves each loop gently contracting every 15 seconds with a linear force of 4 ounces or 114 grams, then immediately releases, allowing the tissue to rebound to its unloaded state. After measuring tumescence, if a 6 millimeter increase is detected, indicating possible erectile activity. The device takes a second measurement every 30 seconds. Subsequent measurements apply a linear force of 10 ounces to assess rigidity. Rigidity is measured as a percentage of the radial compression compared to a steel rod, which is quantified as 100%. The device records data continuously, which can be downloaded to a computer for analysis. This provides graphical and tabular displays of base and tip penile rigidity and tumescence for physician interpretation and is compatible with all Windows software. So in the Generation 4 system, more screens can now be resized, sorted by almost any patient record information, patient ID, birthday, and so on. It also features an upgraded modern database capable of utilizing imperial or metric units with automatic database backup. Generation 1, 2, and 3 devices can be upgraded to Gen 4 software. So below, we see an example which shows the rigidity and tumescence of both tip and base over the course of a night of recording. What we see here is a representative graph which allows you to download the data to present to and explain the figures to your patient directly. As you can see, there's always a direct link between tumescence and rigidity. So just to summarize, GOTOP have updated and upgraded the RigiScan PLUS generation system with new system running on Windows. It has a USB port, high resolution graphics, has a much better user interface and a much more up-to-date database that is more stable. Older generations of RigiScan, as previously mentioned, can be upgraded to the Generation 4 system, providing the ability to connect to newer computers and offering all of the features of the RigiScan Plus Generation 4 system is capable of. So leading on to nocturnal testing, we value this as the gold standard methodology for recording NPT, and researchers have definitely documented that to be the case. How do we incorporate nocturnal testing into patient assessments? So we suggest wearing the device for 2 to 3 nights for an accurate reading. Often, if a patient is in a new surroundings, sleep isn't of the best quality, and you often get that first night effect. So a second and third night improve results accuracy. We always recommend placing 2 new batteries into the device daily to ensure there isn't a lapse in data due to battery cutout. And there's always the possibility of linking RigiScan usage with a sleep clinic or a private hospital room access. Here we see the illustration of where the loops sit on the penis from the tip and the base as attached to the device in the leg wrap and an example graph. The biggest aspect of utilizing RigiScan and NPT is to try and find somewhere for the patient to sleep at night, which is both comfortable but also provides a good clinical assessment. So utilizing the link with sleep clinics is a really helpful approach. Sleep disorders like obstructive sleep apnea or insomnia can negatively impact on sleep quality, which can then have an impact on erectile dysfunction. By integrating NPT tests in sleep clinics, it can help to identify sleep-related causes of erectile dysfunction and enhance patient outcomes. Once severe organic ED is confirmed and the non-surgical treatments for ED pills fail, such as pills, pumps, or injections don't work or aren't convenient, a penile implant becomes the next logical step. As part of patient counseling, physicians can explain the implant options, helping the patient make an informed decision. Then the surgical referral can be made. But could there be a route for the patient to go straight to an implant if they are not able to get good quality erections during NPT? Could there be a route of incorporating RigiScan into provocative testing within an outpatient clinic? Offering a real-time penile tumescence and rigidity monitoring could be a really good route forward for getting that clinical assessment for patients in a timely manner. A recent paper identified the use of audio-visual headsets in combination with RigiScan to be an extremely successful opportunity to measure data over a 35-minute period session. Patients were selected to watch a 20-minute erotic video shown via a virtual reality headset, and participants were specifically instructed to avoid manual genital stimulation. The participants in the study ranged from ages 18 to 60 years and were screened for analysis in 3 clinical centres from June 2020 to March 2022. A total of 301 cases and 100 eligible control patients were included. For final analysis of the study, found that audio-visual provocative testing can effectively improve the diagnostic accuracy of ED. The average rigidity and effective erectile duration were the optimal diagnostic parameters for excluding ED. So here is an example order. The RigiScan Plus device costs £13,280, but does include disposable components for single patient use. You get 12 disposable loop covers, 12 disposable leg straps, and a box of 12 Duracell 9-volt batteries. Annual calibration is recommended to ensure the device is functioning accurately with no lapse in data quality. We are also introducing a 1 and 2 month rental option to wet your feet and get used to the RigiScan concept in your clinic again on a daily basis. Details to follow. If you have any questions, please direct them to us by email on contact@imedicare.co.uk or call our office on 01923 23 7795 Monday to Friday 8 AM to 5 PM to request a rep callback.